Okay, so we have a patient here, Nelson Taz, 78 years old. He is admitted to the orthopedic unit with a femur fracture. He is in a Bucks traction. The first thing I'm going to do is verify the doctor's order. Before I go to the patient's room, I'm going to introduce myself. I'm going to verify the patient using two identifiers, like name and date of birth, and match their armband. I will perform hand hygiene, and I'm going to put on gloves at this time. I'm going to explain to the patient why I'm here, just that I'm here to check traction. Basically, the traction is for his fracture to align and stabilize his bones again. The two most common types of traction are skeletal and skin. And in these, both types of these tractions, you can, patients will report that they have muscle spasms. When a patient is not in alignment like this, with the legs not in alignment completely, that will cause muscle spasms. So you want to make sure that you're always have the patient in alignment where it's straight, right here with the weight. There are things you can do for muscle spasms. You can make sure the alignment's correct. You can give pain medications if that isn't the main source. You can also do non-pharmacological pain medications, distraction, dimming the lights, just comfort measures of any kind. If the pain does not subside and it's pretty severe and the pain medications aren't working, you do want to call the provider. There might be other things going on. So when you are coming in to check the traction, you want to make sure that this weight here is off the ground. You want to make sure that's swinging freely like that. That does make sure that the weight is coming off of the leg and it's working properly. They do have the trapeze here for him to be able to sit up. So that's right above his head. You do want to check, there's a traction acronym, but I'm just going to kind of go over the steps that you do want to check. You do want to check his feet. You want to make sure that there's not any skin integrity difference. You do want to check his temperature. You want to check the skin around the pins. If you're able to, you want to check the pulse in the foot. You want to check the capillary refill. Again, the alignment. You do want to make sure that there is not any abnormal pain going on outside of the normal pain expected. You do want to make sure that there's no pallor in the extremity. And because this patient is on bed rest and in traction, you do want to make sure that they are, intaking more fluids than normal. If any of these things are out of line or out of normal range or abnormal for the situation in the patient, you do want to call the provider. You also want to make sure at this time to check the ropes to make sure that they're not frayed, busted, wearing out, anything that could cause the weight to not distribute the way it's supposed to. You would just have to address that situation if you came across it. You do want to make sure again that this weight is hanging like this. It is not on the floor or the bed. You want to make sure that again, the rope is good, the legs aligned correctly, it's all in the right position. Once you go over all of that all over all of those steps for the patient itself, and you want to check the traction, you do want to make sure that the traction is applied and the correct weight and counter force is on the leg of the affected leg. You want to make sure that it's functioning properly, again, with the ropes, the weight itself, the whole traction setup. You just want to make sure that it's functioning, the pins are correct. Just if it's not, then the purpose of the traction would be for nothing if it's not working correctly. There are pulleys sometimes. You do want to check those. You, again, make sure the weight is correct. I can't emphasize that enough, because if the weight's not correct, again, it's not doing much for the patient. You do want to check circulation often, because with the foot and the traction, it's easy to circulation isn't going to go to the foot like it would normally. So you do want to check that for paresthesia. That could be a neurovascular complication. You're going to tell the patient at the same time that you're checking for all these things, and then that's what you're assessing. This patient is on pain medication. He is prescribed morphine for severe pain and Norco for moderate pain. So you do want to just determine what his pain level is and administer those as needed. His traction is set at 5 pounds, so you want to make sure that that is correct. And before you leave the room, you just want to make sure that the patient's comfortable. Again, ask him if he's in any pain, if he would like anything to drink. Maintain safety at all times. Place the call light within reach of the patient, just to make sure that he can reach you if he needs anything. And that is pretty much it.